So anybody showed up yet? The awkward silence in a class.
Thank you.
You're late.
I know, I remember this.
That's right. Is that it?
Sorry, no, you're fine.
All right, we're gonna get started. Welcome to EMT class. I'm Brian Witherell, I'm your instructor. There's introduction to EMS 1001. These classes teach you how to become an EMT and how to pass the National Registry test. That is our focus of this class and our entire objective. Anybody have any questions before we get started? All righty then. So the first things we're going to teach you about is adversity, negativity, and failure, which are all part of this job. You cannot accept failure, you're not going to get through this class. You are going to fail many, many, many times. We're going to keep having you fail until you learn to do it perfectly, and then you can't get it wrong.
Everyone's checked in with us here, so.
Perfect. So whenever you're ready to start doing pictures, just bring them out row by row like you usually do.
Okay, last row, come on out.
So throughout your life in emergency services, you're gonna face these things. But what makes or breaks you, you don't control these things happening. What makes or breaks you as an EMT is your choice of actions when you're faced with adversity, negativity, and failure. And that will determine the outcome of what happens for you, what happens for your patient. And it pretty much works that way in your personal life too. So you're not responsible for the choices that other people make, but you are 100% responsible for the choices and decisions that you make. There is no excuses. What you choose to do is what you choose to do. Doesn't matter what anybody else did. Doesn't matter what else happened. You either did it or you failed. There is no in between. Negative influences are never an excuse for poor choices. If you made a poor choice and you failed, you learn from it. You make sure you don't do it again and you move forward. You don't blame whatever caused that influence for you to make that choice. You learn from it so you can get better. Any questions? All right. So you're going to get asked a lot, is your best good enough? They're always asking that question. The answer is
Next row.
next row, go. Is that if your best effort didn't accomplish the goal you were looking for or you were hoping to achieve, then no, it's not good enough. But the good news is you learn from it, you identify what went wrong and why you didn't accomplish it, and you move forward with plan B. And you try again. And if you fail again, you identify what went wrong, then you go to plan C. You keep doing this until you succeed. Or you just fail and walk away. I don't think that's ever a good option. So if you fail despite your best efforts, that's okay. Learn from what you failed by, try harder, study more, practice more, and do it again. If you don't improve and move forward, no, your best wasn't good enough, and you're never going to improve. This entire class is about improving. These are critical viewpoints and attitudes that are essential to get you through a 180-hour class that you're going to be doing in 9 weeks. We're going to knock this out in 9 weeks, 180 hours, 6 units. It's a lot to this class. It's fast-paced and it's intense. Not going to lie to you. You're going to have to study hard. You're going to have to practice. You're going to have to get used to failing, learning from it, and doing it again. Any questions? All right. Preparation is everything. You should have your chapters read before class. There's a schedule in the packet. I handed out to you. It's also on your canvas. Chapters on those dates, you're supposed to have those chapters read. And the practice test done before you start class. We're going to go over about the practice test here in a little bit. So, it doesn't matter how good you are, what level of skills you're at. If you're not prepared, you're not going to make it. We expect you to get at least 9 out of 10 on your practice exams before each class. Again, the schedule, it's on there. You can take the practice exams as many times as you want. I recommend you take them until you get 10 out of 10 5 times in a row. And what it is a question bank of like 50 to 60 questions per chapter that throws you, picks 10 random. So that way you just keep seeing different questions. You keep practicing. There are no right and wrong answers in this class with tests. It's about what's the best answer or what's the least bad answer. They'll give you a situation and they'll give you 4 different answers. All 4 may be right, all 4 may be wrong. Next row. You've got to figure out this critical thinking, which we're going to teach you how to do, to choose what the best answer is. So you might choose an answer that's correct, but if it's not the best answer, you're going to not get points for that question. Make sense? All right. If you're not physically and psychologically prepared for this class every day or at work, you're going to fail. So you have to be prepared. Any questions? Our objective is for you to succeed, not to fail. You have to understand though, nobody is a natural in this field, in any part of emergency services. It takes a lot of study, a lot of practice, and a lot of failures to get to the point where you don't get it wrong. Amateurs practice till they get it right. Professionals practice till they can't get it wrong. We expect at the end of this class that you will all be professionals. That's what our goal is, and that's what we're training you to do. Any questions? So some examples. If you fail, you identify the failure, you take action, make sure it doesn't happen again. If you make an excuse for why you failed and blame it on something else, you're going to continue that pattern of failure. And that goes with everything in life. You can either choose to learn from your failures, move forward, not blame anybody but you, make the proper adjustments, and then you're going to be fine. Examples: if you don't properly assess a patient's airway or uncontrolled bleeding, your patient dies. Doesn't matter the reasons why you didn't assess the airway or control the bleeding. They're dead. You failed. There's no excuse. You learn from it, you move on. We hope that by the time you get out of this class, that never happens, because we've run you through it so many times that you can't get it wrong. But the biggest thing is owning your mistakes, correcting them, making sure they don't happen again, and not blaming anyone or anything else. Any questions? Because you're going to run into a whole bunch of obstacles and obstacles, trust me.
Next row.
Next row. I think I would start this thing. Did I go backwards? Okay, that's me. That's my phone number. It's on the packet. I'm also the operations manager for Mount Shasta Ambulance. Don't call Mount Shasta Ambulance. They'll never get the message to me. Call or text my cell. I'm going to try to be in here. I'm available myself pretty much all the time. So office hours, even if I'm not here, you can call or text me anytime. I may not get back to you right away, because I also do work on the ambulances too, in addition to being the operations manager. So I'm kind of scattered and all over the place, but I'll eventually get back to you if you text me. I'm going to try to be in here as early as I can on Mondays and Tuesdays. If you have questions or want to come in before, it all depends on, I'll leave the ambulance, come here, go right back on as soon as I get here. Except for Thursday nights, that's my mini weekend. Then I'm off till Friday morning. Any questions? Felony convictions. If you have a felony conviction, doesn't mean that you can't be an EMT, but if you pass this class, you're going to have to go through a whole lot more with the state of California to get your EMT license. So be prepared for that. They make me tell you this now because people have gone all the way through this class and then been furious when they go to the state won't give them an EMT card because they have a felony conviction on their record. So you may want to look into that or start preparing for that. It's not an absolute no, but they're going to make you go for a review board. They're going to study you and make sure that you move forward since then. Any questions? This is a college class. College people like to party. We lose usually about 1 to 2 people a year to DUIs during this class. If you get a DUI while you're taking this class, last row, you're probably not going to get your EMT license, especially since it's fresh, since you got it while you're taking this class. I strongly recommend you do not drink and drive while taking this class. Any questions? Who needed the book? You walked out. He's out, get his picture there. Any questions about DUIs? So you're gonna have, so the way this works is you pass this class, then you got to go take National Registry tests. National Registry is a nonprofit organization, is not a government agency. They just do testing. And then the states accept a pass from the National Registry as certification for their state. Then you got to go pay the state on top of that. National Registry sometimes will not even let you take their test if you have a DUI in your record. So even if you get through National Registry, then you got to go through the state. So yeah, it makes your life really, really hard. So I strongly recommend you don't do that. Who needed the book? Somebody over here? I swear to God, somebody said they need. Because he's coming back here. Wasn't okay.
I knew about
You need a book? All right, well, there's a guy coming with a book, so grab him when he gets here.
Brian, can I just ask one question?
Yeah,
Did everyone get their photo taken? Yes? Oh, did anyone not get their photo taken? I'm sorry. And did everyone sign the media release or did someone not? I'm so sorry, I see the back.
it's okay.
Everybody signed it. Okay, we're done.
Everybody got their t-shirt order?
I did get everybody's order on here. So I will place that order tomorrow with Karen, okay? All right.
Thank you.
Thanks, you guys. Have a great class.
All right, objectives. Develop and upgrade your skills and to get you to the highest quality of EMT that is possible. To be eligible to take and pass the National Registry exam and then go to whichever state that you want to become an EMT in and pay them to become an EMT. Questions so far? Yes.
You just pay them? You don't have to take another test too.
Nope. It's all bureaucracy. You gotta pay National Registry to take their test. If you fail it, you gotta pay them again. And then for the state, you gotta go, I'm gonna go through it here in a bit, but yeah, then for the state, you gotta pay for a live scan. And then pay for the card, and they just take your money, it costs them nothing, so. Yes,
So if I want to be a paramedic, am I gonna have to go through that too?
yeah, well, I mean, you should become an EMT first. And then go into the paramedic program, and then you're gonna do all the same things for paramedic again. And then if you wanna drive an ambulance, they're gonna make you take another live scan and a DOT physical. And then apply for an ambulance license. And you're gonna have to pay the government for all of those things too. Yeah. It's all revenue generation. It's very, very good revenue generation. Any other questions? I don't control any of that. I'm just here to teach you. And prepare you. So again, there's a lot of confusion. There is no national certification for EMTs or paramedics. It does not exist. National Registry is a private nonprofit company that does testing standards. If you're a firefighter, it's like Underwriters Laboratory or Factory Mutual. You know what that is. They just set standards, or NFPA. They just set standards. That's it. States will take you passing their tests for standards to certify for their state. But you got to present that to them and then pay them. Any questions? And every state's gonna have its own scope of practice. Attendance. So California Title 22 is the law that EMS falls under for the state of California. It requires, if we're teaching this class, you have to be in class a minimum of 170 hours. No ifs, ands, or buts about it. Anyway, sorry. I couldn't help but look at you. So COS is giving me another 10 hours, basically 2 classes. So that way you can miss 2 classes, because things are gonna go wrong during the semester. You're gonna get flat tires, you're gonna get sick. You're gonna have a family emergency, something's gonna happen. So you can miss 2 of the night classes or 1 all-day class. Can't miss a combination. And that's all you can miss. Because then you will not meet the state hours for this class. I know, that's a narrow window. Unfortunately, 180 hours is the maximum for a 6-unit class that COS is allowed to do. And they're not allowed to go over 6 units, so it would have to be 2 separate classes. And 2 separate semesters. So hopefully they don't raise the bar anymore. Any questions? And that's excused, it doesn't matter, just like anything else. The reasons why you're not here doesn't matter. You gotta be here or you're not. So I don't suggest you burn them around. I don't feel like going to class today. I think I'll take one off. And then something else happens, and then something else happens, and then you don't meet the hours. Any questions? That also includes a partial class. We do 2 roll calls. I do a count before you guys come in. And then at the end of the night, we do a roll call at 10:30. Before you go home, then you're dismissed, and then I document that you were here, and that's how, in case the state audits me. So if you go home earlier, you go home with break, you miss that entire class, you miss the 4 hours. Any questions? All right. You also have to participate. So we do lecture from 6 to 8. Take a 15-minute break, then we come back and we do skills every night from 8:15 to 10:15, and then we do a wrap for the class. And then 10:30 we go home. Any questions? But you have to participate in skills. You cannot not participate. And we got a great system for skills. A lot of people come in on their own time to help out. They volunteer to help you guys. As proctors, they're all volunteer instructors. They're great, and they'll help you get through this, and they're gonna run you through it. You're gonna practice till you can't get it wrong. You're literally gonna do these skills thousands of times. Any questions? This includes fires. If you go out on a fire, there's nothing I can do. I don't make the rules. I don't make the state laws. There's nothing I can do. I'm a firefighter also. I love going on fires, but I get it. But you can't. Just there will be other fires, I promise you. It never stops. Any questions? All right. Skill station again. We do skills every night. Skills have to be perfect. You're going to fail your skills hundreds of times, if not thousands of times, but you're eventually going to pass it at the end. Because I've never not had someone that stuck with me all the way till the end and not been able to do their skills. It's physically impossible, as long as you're putting the effort in. Any questions? You got to bathe and be clean before class because you're going to be doing skills on each other. So if you're coming to work with or coming to school with body odor, dirty socks, not clean yet, we take shoes off too. So it's very important that you be clean and kept before class. Again, we're going to have volunteers come in from fire department, ski patrol, ambulance, all kinds of people come in to help us. They're awesome. They make this class the best class I've ever seen. And please show them appreciation. Please don't be, if you want to be mad about something or mad about failing, be mad at me. I'm paid to be here. So, and I'm the one that has the final say, and I'm the one that made the rules. So if you're mad about it, then be mad at me, come give it to me. I can take it. Any questions? And if there's something that's confusing or wrong, I can probably set the record straight. All right. So again, sometimes you might get confusing information. One proctor might tell you something, another one might tell you something else because they're from different agencies. Come to me, I'll get the record set straight. I'll get it set straight with them. It does happen. That's what that is, conflicting information. Got a little bit ahead of myself. All right, team events. So once we teach you guys all the basic skills, which we'll be starting tonight, in about 2 weeks or less than 2 weeks, we'll start doing team events where we do entire scenarios. And you take turns being the leader and you guys practice and do scenarios and do it until you get it perfect and you compete against each other. There'll be probably at least 4 teams in this class. As long as everybody stays. If people start dropping, then we'll have 2 teams. But holy cow, we might even have 5 teams. There's a lot of people in here. Any questions? Got to have your CPR card by exam 2. If you don't have it yet, please make sure that you get it. You also need to get a negative TB test. You can go to a clinic, a health department, your own doctor, but you've got to get it before exam 2. These are required for ride along.
Will you take a quantiferin gold?
Take a what?
Will you take a quantiferin gold?
What's that?
It's basically a TB test, just in a different format, or does it have to be the 2-step?
I have no idea. I think it has to be the two-step unless you're positive, and then you gotta send them x-rays. It's actually not me, it's the contracted facilities. It's Fairchild Medical Center and not Shasta Ambulance. It has nothing to do with class, it has to do with your observation time. Well, then it'll probably work. I'll have to ask.
I took it last semester, but I thought the ticket again or the.
Less than a year?
Yeah.
You should be good.
Alright.
You're still gonna have to upload it into the form though, like you did last semester. Flu shot. If you don't want to get the flu shot, you gotta sign a declaration saying that you'll wear a mask the entire time during your ride along time. But they do allow that also. Let me know if you need that. You're gonna have to go online and go to ICS 100, get your ICS 100 on your own time. Question?
On this, because I was trying to do the ICS 200 yesterday. What if it says you can't log into it? It's saying that your email doesn't match what's logged in for it. On the.
You need to take that up with FEMA, contact FEMA customer support.
Okay.
So you got your ICS 100, then it told you for your 200 that it didn't support that email.
Mm-hmm.
That's very odd.
When I
That's a
went to go take
customer.
the final exam for it. Then I went to
Interesting.
go log in.
I would contact FEMA customer support and they should be able to help you with that.
I just wanted to know if it's like okay to just get up during class to like go to the bathroom anytime.
Absolutely
Okay.
not. Yeah,
Perfect.
we go a long time, we go like 2 hours lecture.
Okay, that's what I was wondering, yeah.
I recommend though, my personal recommendation is you use the bathroom before you start class. You should be able to make it 2 hours. But if you have to, yeah, it's fine. I already got my EMT, you'll be doing one this. So then after ICS 100, you need to go get ICS 200. You need this on your own time. You need this done before the second exam. And you also need to do introduction to hazmat. These classes are free. They're online on the FEMA website, but you need to get them because it's required for your ride-alongs. I want to get ride-alongs going as soon as possible, especially since there's 29 of you. There's only going to be so much time for ride-alongs. So, Title 22 requires you do a minimum of 24 hours observation time in an ambulance or in an ER or a combination of the two. And in that time, you get 10 contacts. So, about that. I only have contracts for this class with 2, actually 3, because that ambulance is doing it. And Mount Shasta Ambulance and Fairchild Medical Center in Wairika. Everything else that is corporate, like Mercy Mount Shasta, AMR, Dignity, all those require the same amount of stuff as the nursing class for you guys, which puts about another $600 cost onto this class. So I've chosen not to do that. I'm still doing the standalones because they don't require those things, and that's the reason why. But that said, you got to get a minimum of 10 contacts. If you are on a volunteer fire department, I will take contacts from your fire department, but you still got to do the 24 hours observation time. I strongly suggest if you're not on a volunteer fire department to join one, because it is truly the best way to learn how to be an EMT is going out and running as many calls as possible. You can join tomorrow. Yes.
With the tech contacts, just mean contacts with people working there.
No, contacts with patients. You gotta actually see 10 patients. Physically see if you get canceled before you get there, it doesn't count. Yes.
Does it count if you call them?
What's that?
Does it count if you call them?
Yeah, it counts. Because termination of death is part of being an EMT. It's one of the protocols. Questions? And you still got to write a PCR for it, too. So yes, you got to do 10 contacts, and for those 10 contacts, you got to fill out a full patient care report, which we will train you how to do. You cannot take the final until you bring me 10 full patient care reports and a filled out log of your 24 hours of observation time. You can do more than 24 hours. You have to do a minimum of 24 hours. I also recommend you don't do the minimum. If somebody in your family or your loved one gets hit by a truck, do you want the EMT showing up at the bare minimum of an EMT class, or do you want the one that did it until they couldn't get it wrong? Just think about that. And if you're, why would you want to be that person? All right, so here's the list of stuff. Got to get our HIPAA done, which that's easy. All you got to do is sign it. I'll give you the packet. Actually, it's online. I've got an online packet. You just got to read it, sign it, print it out, sign it, take a picture of it. You either print it offline or I have copies of it. I'll give it to you. And then I've got an online form. You're gonna take pictures of it with your phone. I'll show you how to do it. And you upload all that. And when you do that form online, it will then put it all, your certs and all this stuff into one PDF packet and will automatically email it to Fairchild and the Mount Shasta ambulance. And they'll have everything on file. Once they approve it, then you can start your ride-along times. If you don't do it, you don't have ride-along times, you won't pass the class. I think I've got a video showing you how to do it. Sometimes people get confused. But there's a link to that form on your Canvas. So, blah, blah, blah. Yep. It is a learning time. You've got to be part of the team that you're assigned with at the hospital or in the ambulance. It's not a time to sit on your cell phone and play video games. Any questions? Everybody at Fairchild and everybody at Mount Shasta Ambulance knows me and has my cell phone number, so they will let me know, and you'll have to repeat those hours. I promise you. Any questions? All right, here it is. So this is how you upload your packet.
Okay, everyone, this is how you do that. Once you have this form filled up, you can click on any one of these. And you put your email in. And it will open the document for you. You can print it out if you don't already have your documents. And that's how you get each one of them. And of course, these are the links to your ICS and your hazmat training. So all you have to do is click the date. Let's say today is Monday the 18th. Put your name, COS, and I'll just put my name in, what the hell. Ryan Witherell. I'll put in my email address, cosemt@gmail.com. And then the first one we're going to do is our HIPAA forms. So there's going to be 6 pages of that. You upload all 6 pages. Okay. So what I'm going to be doing here is making up pages that aren't really existing because I don't have the HIPAA pages, but this is how you do it. So you hit submit file. This screen will come up. You click browse, then select camera. Then there's your HIPAA form. You just take a picture of it. Click OK. It'll upload that picture for you. Someday. And then once that uploads, then you go to the next one. You do the same thing for the next file, the next file, the next file. Until you get all the way down to the end and you have everything uploaded. You click submit, it will automatically submit it to me and I automatically submit it to Fairchild so that you can get approved to start your ride time. Have any questions? Let me know.
And the link to that is on your Canvas, and I'll show you where it's at here in just a little bit. So, I'm not sure why this is 3 categories. There's 4 categories. 3 categories are pass fail, and the 4th category is your grade, which is the results of your exams. The category A is pass or fail. You either make the 170 hours or you don't. Make the 170 hours, we're good for category A. Category B, that's your team events. You have to successfully pass every one of your skills exams, which again, no one's ever failed on this. Sometimes people have gone to the very last night, but last couple of years, we've had everybody pretty much knocked out before the last 2 weeks. But we do them again and again and again and again and again until we can do the entire skill perfectly. So you have to pass all of your skills exams and get 1,000 team points in the team competitions. So the way the team competitions work, teams that win get 100 points or 10 20 points. And then whoever's got the highest point total the night gets 100 points, and we do it every night. So you gotta do is win 10 different nights. Actually, you don't have to win that many. Any questions on that? Category C is your affective or effective behavior. We're teaching you to be a professional. You have to act and look like a professional and talk like a professional. In addition to being able to do this to the point where you can't possibly get it wrong. So if you have behavioral issues in class towards your teammates and towards your proctors, it will dock you your team points, or we can just bail you out on behavioral issues. So be professional at all times. And that's inside your packet: respect, your attitude, personal accountability, and your integrity. Don't ever lie, and don't ever say something that's not accurate, because you will be labeled with that for life in your career. So again, appearance. People do judge a book by its cover. You have to have professional appearance. We're going to get you guys t-shirts and badges. You're supposed to wear those to class each night so I don't get in trouble. You have to wear those on your ride-alongs too, so that everyone knows that you're a COS EMT student. Any questions? All right, then the last category, the exams. That freaks everyone out. So your first 6 exams are 50 points each. That's 5% of your grade. It used to be a lot of people bombed the first 2 exams. Hasn't been that way for the last couple of years, ever since we started doing the practice tests. People got pretty good at learning how to critically think and how to take critical thinking tests. But anyway, the big exams that you have to pass, if you fail the smaller exams 1 through 6, it's not a big deal. It's just going to make it a lot harder when you get to your midterm and your final. Your midterms were 30% of your grade, and your finals were 40% of your grade. People have come into this class that are failing and have smoked the final and become EMTs. It is doable. I recommend that you study and you do as many practice exams as you can, and you pay attention, and you read and you learn and you practice, so you don't put yourself in that situation. But even if you do get in that situation, you need to, you're gonna have to do really good in the final. Now, the practice exams, which are on your canvas, are expected to be done before class each night. Schedule's on your packet there. If you do not have a 9 out of 10 on each practice exam before class starts, I deduct 1 exam point for every chapter you don't have that on. And that's like compounding interest. When we come back the next night, if you still don't have those previous chapters, you'll lose another point again for each chapter. So the first night, and I'm not going to make you guys do this till Thursday. So like, I don't expect you to have chapters 1 and 2 done tonight, because we just started. That'd be crazy. And then tomorrow night, we have to have by 1 through 4. I'm not going to make you do that either, because I know you're getting your feet underneath you. But by Thursday night, I'll start docking points if you don't have 1 through 5 with at least a 9 out of 10. Now, if you have a 10 out of 10 on everything, when we do the wrap, I may let you go home early if you have perfect scores in all your practice exams. If you don't, you're going to stay here and answer questions for me until you can go home. And if you can't answer questions, you're going to be here all the way till the end. Any questions on that? So you got to do your practice exams. It's critically important. I've also put study guides for every chapter on Canvas this year. So you guys have that too. There is no makeups. There is no second chances on the tests. You either know it or you don't. Again, though, the first 2 or 3 exams, if you fail them, you can make that up on the midterm. That's just your makeup. It'll be 30% of your grade. All 6 of your smaller exams equal to 1 midterm. Any questions? You need 75% average to pass the class. 70% of the class points is the midterm and the final. That makes sense? Any questions? So you get 75%, and you also got to get a 75% of the final. You can't fail the final. If you can't get a 75% of the final after 170 hours of class, there is no chance of you passing National Register. So that is a fail. So if you have like an 82%, you don't think you need to study for the final, and come in, you get a 74 on the final, you'll be coming back to take the class again. Any questions? All right. There's the grading: A, 900 to 1,000 points or 90% above. B, 80% to 90%. C is 75 to 80. There is no D, because D is a passing grade, and we don't pass people below 75%. So we skip D and go straight to F. Any questions? All right. Clean up. Share this classroom with the paramedic class and other classes. We need to make sure everything's cleaned up, straightened up, all the equipment's put back exactly the way we found it. Before we do our last roll call. And then we expect it to be the same for us. And I'll make sure that it is. Any questions? So I come in here and teach paramedic in the daytime a lot too. All right. Refresher student, do you have any questions?
No, sir.
So become an EMT, first you gotta pass this class. Then you need to take the National Registry exam. I recommend after you take the final, schedule your National Registry exam the next morning. Do not wait. Do not wait. After the first 10 days after the final, your chances of passing National Registry drop drastically. Once you're not doing this pretty much every day, it will escape from you. Then after you get your National Registry, then you can go to whichever state you want to be an EMT in, show them your National Registry, and then pay them. Any questions? For California, don't pay $105. It's not right. It's much more than that now. I'm not sure how much it is, but it's more. Yes, they're going to require your National Registry, your CPR card, a photo ID, a live scan, and then pay them. And you can actually do it all online. You just upload it to their website. And again, I cannot put enough emphasis. Join a volunteer fire department, run as many calls as you possibly can when you're not in class. And this stuff will make way more sense than just listening to me talk. Any questions? Even though I'm a very interesting guy to listen to. All right, so we got 2 more presentations we got to knock out before we go to break. So. These first presentations, I'll admit, aren't the most exciting. But once we start getting into trauma and patient assessment and shock, they're pretty good presentations. All right, thought for the day. It's okay to not like everyone or every agency you work with. And probably in this class, you're gonna have people you don't like. Knowing not everyone's gonna be friends. It just doesn't work that way. Even just aren't like that. It's okay to have a difference of opinion. That's fine too. Everybody's got an opinion. But it's never okay to let your dislikes or your difference in opinion affect your team or your patient quality of care. It's never about you. It's always been about the patient and their family. The patients and their loved ones should always come first, no matter how angry you are, how upset you are, or how much you hate the person that you're stuck working with or the agency that you're stuck having to work with. None of that matters. What matters is that you work as a cohesive team for the patient. Any questions? You can duke it out once you get back to the fire station or the ambulance station, but never on a call. Once the pager goes off, all that goes out the window. Patient and their family is the most important thing. It's never going to be about you. If it is about you, you should probably think about a different career. Any questions? All right. What do you need to know? Find emergency medical services. Know your EMS history. List the 4 levels of EMS certification. These are all going to be test questions, by the way, on your first exam. List the roles of each of the 4 levels. Know the 14 components of the EMS system. Understand what medical direction is and how it works. and the roles and responsibilities of the EMT. So overall goal of an EMT, a good example is you're expected to do a scene size up to make sure you don't get yourself or your team killed. Do a good patient assessment. Based off the positive findings of your assessment, form a primary impression. Then choose the appropriate protocol to treat your patient. Get them to the hospital, transfer care, and get ready for the next emergency. Any questions? It's a great, easy job. Once you get it down, you can do it with your eyes closed. EMS history, this is the first ambulance I worked on. No? All right, World War I. It's the first time they actually started using motorized ambulances. But they were true meat wagons, pretty much loaded and left. World War II is when they first started providing some aid and started training corpsmen to work with the doctors and nurses, try to do some aid, but it wasn't until Korea when they started understanding compensated shock and understanding that most people, if they survive 5 minutes, no one dies between 5 minutes and an hour on traumatic injuries. And they get them into surgery within an hour. They got a 90% or better chance to survive. That's where the golden hour comes from. They figured that out in the Korean War. And that's when the first real EMS started. So moving forward, after Vietnam, most ambulances were run by funeral homes. That's why they were station wagons. They were hearses. They just put a light on them and painted them a different color, took the curtains out. Sometimes left the curtains in. And the reason why funeral homes ran it, because you weren't expected to live, and then they had an upper hand on the interment services to say to family, hey, we already got a relationship, you know, we can handle the burial. And that's seriously, that's what it was. But in 1966 to the early 70s, that's when EMS started to happen, because they found out that people had a better chance of being shot in Vietnam and surviving than they did getting in a car wreck here in the States. Because there was no real EMS system, and the military had really perfected the trauma system between Korea and Vietnam. So that's when they started training EMTs, they started becoming paramedics, and they started the true EMS system here in the United States. Any questions? So emergency medical services is a multi-level team approach. It's like a big set of gears. And if one of them doesn't work, the entire system fails. EMT basic, which is what we're learning tonight, is the main functioning drive gear of the entire EMS system. No EMS system can work without EMTs. And where does the framework come from? You need to know this. National Highway Traffic Safety Administration and the Department of Transportation. They set the federal framework, and then the states develop their EMS systems based off that framework from NHTSA and DOT. There'll be test questions on that. Any questions? All right, there's your levels of EMS certification. First level is emergency medical responders, usually 40 to 60 hours. Usually used for law enforcement, fire, state parks, etc. Then EMT, which is the backbone of the industry. That's usually at least 160 hours. Has all basic life support, some advanced skills, upper level airways, can work on an ambulance. Then advanced EMTs, that's for rural areas that can't really afford paramedics. There's not enough call volume for paramedics. There's usually volunteer agencies that have some advanced level skills like IVs and medications, but not quite the level of paramedic. And then paramedic is the highest level of certification, usually a minimum of 1,500 hours, I believe, 2,000 hours of training. Any questions? Going a little fast because we're running a little long. There's EMR, 40 to 60 hours. Most BLS skills, but doesn't include the supraglottic airways, which are the like the IGLs you put down, but it does include defibrillators, automatic external defibrillators. Any questions on what an EMR is? All right, EMT basic. It's a minimum of 160 hours of training. It's the entire BLS scope. Has some medications, has more advanced airways. You can work on an ambulance. And depending on the state or the area in the state, they may have an expanded scope for that specialized area where you can do even more stuff. Any questions? EMT advanced is usually 300 or more hours of training. It's limited advanced life support skills. Pretty much all of them do IVs, and a limited number of medications may or may not be able to use cardiac monitors. But it's generally for rural volunteer areas is what it's designed for. Any questions? Then we got paramedics, 13 to 2,100 hours, depending on the state. Full advanced life support medications and skill, and their scope of practice varies from state to state. Any questions? So roles, EMR, they're usually the first ones on scene. And EMTs, they may be also on police or fire, but oftentimes they're on an ambulance. They do packaging, basic life support, setup for advanced life support. EMT advanced or rural areas, limited advanced life support, then of course paramedics. They're the ones that are the highest level and show up. And I think they're a lot better than they are. EMTs save a lot, or paramedics save lives, EMTs save paramedics, is the saying goes. Any questions? All right, professional attributes of an EMT. You've got to have integrity. You also have to have empathy. If you don't care, you're not going to be a good EMT. I promise. You got to be self-motivated. No one's going to do this for you, especially in this class. If you do not self-motivate and do the work, you will not make it through this class. You got to have good appearance and hygiene. You got to bathe, wear clean clothes. Self-confidence. I promise you, if you make it to the end of this class, come to class every night and every day, you will have self-confidence by the time you finish this class. What that was. Time management is critically important. Again, we're going to teach you that once we start the team scenarios. All those scenarios have to be done within 10 minutes. Seems impossible at first, but by the end of the semester, you will have it down. You got to be able to communicate, you got to work in a team, and you got to have diplomacy. Again, you're not going to like everybody in here. Not everyone's going to like you, but you guys have to learn to work together. Got to have respect, patient advocacy. You may be the only advocate for your patient, and you have to give careful, good delivery of care. This may be about the book. Nobody needs it. Somebody needs a book. Yes. What's that? I will, right now there's only one, but you guys can wrestle for it the whole way.
I have one at home, I forgot. If it's still the same,
It's 12th edition.
it's 10 years ago, I know.
No, you're 11th edition.
Okay.
Has it really been 10 years?
Yeah.
Wow.
Yeah.
I'm still here.
I know. It's still the same ringtone.
It's same ringtones, yes.
Same ringtone.
Hasn't changed. All right, job responsibilities. You got to keep your vehicles and equipment ready for an emergency. If someone's dying and your equipment's not ready, your oxygen's out, your AED's dead, that's not going to work well for your patient. Emergency vehicle operations course, you got to be able to know how to get an emergency vehicle to a patient safely and not kill your team getting there. On-scene leadership, you're all going to be trained to be leaders. Scene size up. You got to be able to know how and when to order help, more resources, how to get to patients. Patient assessment, the most critical part of it. We're going to teach you that. How to give treatments, extrication, work as a team, be professional, be able to look at critical problems and make critical decisions literally in seconds When there is no good answers, choosing the least bad answer for what needs to be done. And do it quickly. Uphold all your medical and legal standards. Make sure you have privacy for your patients. You're gonna have to have administrative support. And this never ends. Once you get out of this class, you still have to do continuing education. 24 hours every 2 years at minimum. And then continue to develop your educational skills, community relations. Those are all the job responsibilities of an EMT. Any questions? Yeah. Components of the EMS system, public access. You gotta have a way for them to call for EMS. Throughout the United States, pretty much, I think, everywhere now, we have 911. Believe it or not, when I first started here, there was no 911 in Wheat. Yeah, that's how old I am. I don't look that old because I'm moisturized. Anyway, you got clinical care. You got to have people trained that can get there and deliver care. Medical direction. You got to have someone that's doing the framework and a medical director. Integration of health services. So you got to have 911 systems, fire departments, ambulances, emergency rooms, and then specialty services like neurosurgeons, cardiac surgeons, general surgeons, things like that can fix the problem. Information systems, you got to be able to have the radios and the cell networks to be able to get the messages out and get the train or get the word back and forth to the hospitals and to the responders and be able to write reports. Prevention, the more prevention you do, the better the system's going to be. Research, which comes off of the reports, what's working, what's not working. I guarantee you every 6 months, something's gonna change because they're gonna find out new stuff and studying what's going on and what's working and what's not working. It's never static, it's always fluid. Again, communication systems that works with the information systems. Human resources, those are the people that take care of you. Legislation, regulation, all gotta follow the laws. Can't cowboy it, unfortunately. Evaluation, you're going to be constantly evaluated for continuous quality improvement. All your reports are going to get reviewed. We're going to make sure that we're all doing the best that we can and we're learning from our mistakes. Nothing works without finance, unfortunately. You got to be able to pay for the insurance on the engines in the ambulances, fuel, pay for the people, uniforms, tires, insurance. Never ends. Then public education, which is what we're doing now. And educating the public, and then education systems, which is what this is. Any questions about how to put an EMS system together? I actually had a student once that he and his family decided they were going to open an ambulance in Vietnam, and they're going to do it in Saigon, and then they realized that there's no components, there's no ERs, there's no one to take you to, and there's no way to call 911. There's no way to, it just doesn't exist. So you got to have all these components and they all have to work properly for your patient to survive. Any questions? So public access has to be easy and has to be readily available. Back in the olden days, we had what we called call boxes. About every couple of blocks, you go and you pull the alarm in the call box, and nobody knew what was wrong. They knew to send someone to that location. And you waited until someone got there and said, it's over here. Unfortunately now, we also, like when I started here in Weed, I was on Weed Fire, there was not 911. So we used to hand out stickers that had Lodge Police, Weed PD, Weed Fire, the Mass Shasta Ambulance all had separate numbers. And we had people put them on every phone. There was no cell phones. And that way they knew the numbers was right on the handle of the phone so that no one couldn't possibly have the numbers. 911, everyone should know, it's pretty easy. We now have enhanced 911 even on the cell phones, on a regular phone, so it gives you exact location of where you're at when you call. And we also have emergency medical dispatching in most places, which is 2 separate dispatchers. One gives life-saving instructions while the other one's dispatching the appropriate resources to get to your location the quickest way possible. Any questions? I talk a lot. All right, communication systems, radios are still the gold standard. Cell phones and digital radio interface are they're coming up hard though. They're coming up fast as being the main thing. DUN is not used, that's dial-up networking, that's like way old now. Everybody's got cellular internet now, it's fantastic. And at the low level satellites, you're gonna start seeing even more and more. And we may be, it's a little tricky though, because those systems do go down, the radio systems never go down, so it's always good to still have the radio systems in the backup. See. Any questions so far? We'll go over that more in detail. Code of care, your scope of practice. Scope of practice is what you're allowed to do as an EMT. It differs from state to state, like be able to give oxygen, be able to administer aspirin for chest pain, stop the bleeding, package a patient. Equipment, oxygen tanks, backboards, stop the bleeding kit, valves, masks, blood pressure cuffs. And then response zones are designed to get the most or the fastest amount of resources to the patient as quickly as possible. Any questions? Human resources, those are the people that help you. That's what makes sure that you have insurance and you get paid or everything's taken care of if you're a volunteer. And they handle all that stuff. Any questions? Medical direction. There's going to be test questions on standing orders versus base hospital. So offline orders, standing orders. That's when your medical director is giving you a set of directions to do in a situation without you having to call and ask. For instance, a standing order for, let's say, if it's a chest pain of a suspected cardiac origin, you may want you to give 324 milligrams of aspirin. You can write that order ahead of time. It's called a protocol. You have a standing order in that protocol. That's in most EMS systems for EMTs. But let's say a patient has nitroglycerin and you can assist nitroglycerin, but with the nitroglycerin, the patient has a prescription for it, but you can't do that on a standing order. You have to call base hospital and get approved to assist the patient. That would be a base hospital. Any questions on the difference between online and offline medical direction? There will be test questions on it. All right. Every system's gonna have a medical director. Every system's gonna have scope of practice. They're all gonna have laws and rules and regulations. Every system should have standing orders. And of course, if he doesn't meet standing orders for your scope of practice, you could always request online orders or base hospital orders. Any questions? So you're constantly going to be evaluated. You do continuous quality improvement, continuing education. Again, the systems are constantly evaluated. In this area, the protocols change every 6 months. They're constantly reviewing, evaluating what works, what doesn't work, and then making adjustments twice a year. This is done through information systems. And the one thing you don't want to be a part of, do not join the secret society of incompetence. When something goes wrong, you mess something up, you make a huge mistake. You don't say, hey, cover me, let's bury this thing. That's not what you do, because then you have a chronic pattern of failure. It's what that will lead to. If you own it, learn from it, make sure everybody else knows about it so they don't make the same mistake, then you break that secret society of incompetence. Make sense? All right. Integration of health services, again, EMS is a gear in a large machine. If one gear doesn't work, your patient doesn't make it. They all have to work together. The 911 system has to work. First responders has to work. Ambulances have to work. ER systems have to work. Specialty centers have to work. And rehabilitation centers get back what's called definitive care. That's a vocabulary word you have to know, definitive care. And what that means is getting the patient back to what they were prior to the incident happening. Any questions? So here's an example. People have to have reliable access to emergency communications. Dispatchers have to be trained on how to get that information and dispatch the appropriate resources. Emergency medical services has to arrive in a timely manner and be able to properly assess, treat, and transport. Emergency rooms have to be strategically placed for maximum effectiveness. And then specialty centers, cardiac centers, neurological centers, trauma centers have to have the knowledge of what happened and what's been done so they can rapidly treat the patient and get them to definitive care. Any questions? So again, obtaining information is critical. Documentation is everything. You have to be able to give good reports verbally and written. I'm going to teach you how to do that. So the surgeons in the specialty centers are not going to know what you saw, what you smelt, what you felt, and what you did if it's not written in a patient care report. If you tell a nurse, the nurse is not going to remember it after she sees 10 more patients, he or she. You have to have it in a good, clear, written report. Any questions? Again, EMS is expensive, no matter where you are and what you're doing. There's public systems, there's private systems, there's nonprofit systems, there's tax bases, there's pay as you go, but finance has everything to do with efficiency and how well things work. It's a sad but real truth. Any questions? Education systems, again, quality care completely depends on the education system. And it doesn't stop when you get your EMT. You still have to continually do constant continuing education, or else they will not recertify you. And it's your responsibility. Any questions? Then prevention of public education. Prevention is a big part of EMS. Doing car seat classes, they do bike radios, teaching kids the proper ways to ride bikes, giving them helmets, things like that. CPR classes. But anyway, most EMS systems require an EMS agency to do some type of public education, whether it is showing children in the schools, the fire engines and the ambulances or something. Yeah, you should be doing some type of public education and prevention. Any questions? And then research, they do that off your patient care reports now, off how the patients do. They look at what can be improved, what is working, what's not working, and that's how they keep moving forward and making EMS better. Any questions? I'll give you an example. 10 years ago, everybody that bumped their head or fell down got strapped to a backboard and immobilized. Nowadays, unless they have a deficit, a neurological deficit, nobody gets a backboard because they found out it was actually doing more harm than good. Any questions? All right, so let's do a case study for an example. So you got patients doing slip and slides. Nice fun summer afternoon. And they overshoot or miss the pool. They get hurt, so the bystanders call 911. 911 dispatchers note the address and location of the call. Start giving pre-hospital or pre-event instructions. While the other dispatcher figures out which are the closest and best resources. Lights off. That's called scorpion. None of these people got an A in physics. Slip and slides are dangerous. The whole streets, yeah. All right, you guys get the point? So 911 dispatcher gives pre-arrival instructions. The other one dispatches the appropriate resources. First responders, usually police and fire dispatch. The ambulance is dispatched. Depending on the system, it may be advanced life support or basic life support. They arrive on scene, assess the patient, look at the positive findings, form a primary impression, choose the treatment protocol, treat the patient. Get them to the hospital, they recover with definitive care to get back to what they were before the slip and slide, so they can do the slip and slide again. Any questions? All right, one more, bear with me, then we can take a break. And then we'll teach you guys your first set of skills. Workforce safety. How to keep you safe and well. All right, this is a job that runs high on emotion and stress. It's always critically important to remember the following things. You're not the one that put anyone else in the position they are in. It was their choice of the factors that put them there. You're there to help that person and the position they're in. It's your job, and despite what their actions were, it's about them. It's not about you. Your life will be good or bad based on the choices you made. And if you continue to make the same choices, you will continue to get the same results. You can either learn from them and improve, or you can continue to keep making the same choices and have a pattern of failure. Any questions? All right, so we're going to learn what an infectious disease is. We're going to learn what a communicable disease is. We're going to go over universal precautions and the different types of precautions. We're going to go over how to transmit a disease and how your immune system works and how to keep yourself from getting infected. We're going to go over the signs and symptoms of stress. We're going to learn what post-traumatic stress disorder is and the steps on how to prevent it. And we're going to go over workplace issues such as cultural diversity, sexual harassment, and unfortunately in emergency services, substance abuse is very, very high. And we're going to try to keep you from doing that. We're going to go over the emotional aspects of emergency care, concerns with death and dying patients and the grieving process for their family, and go over the stress involved with large-scale incidents. We're also going to go over scene safety issues and how to keep you safe. All right, you need to know what the difference between an infectious disease and a communicable disease is. An infectious disease is a medical condition of little tiny bugs that will invade your body and make you sick. A communicable disease is a disease that spreads from one person to another. Now, this will probably be on your tests. All bloodborne diseases are communicable, but not all communicable diseases are bloodborne. Any questions? So how do we communicate a disease from one person to another? Direct contact. Direct contact. You touch the person, an infected person, or you give them fluids. That's direct contact. That's the number one. Number two, which is actually the way most diseases spread, is indirect contact. So, wipe my nose, the disease all over it, put it on my pen. Oh, here, use my pen. Indirect contact. Most indirect contact, though, is you touch something that someone else infected, and then you touch a mucous membrane, such as your mouth, nose, eyes. You rub your eyes, you touch your nose, you touch your mouth. That's how you get infected. That's the number one way, especially with cold, flu, COVID, which is the cold. That is how you do it, is indirect contact. This is not airborne. Airborne, which is actually pretty rare. That's like tuberculosis. That's when someone coughs up some blood and you inhale it. Very, very bad though, if it happens. And then of course, foodborne, if you eat contaminated food. And then vector-borne, fleas, ticks, bites. That's how the plague spreads. Any questions about how to get sick? So now that you know how to get sick, we can start working on how to prevent yourself from getting sick. So standard precautions, also known as body substance isolation, also known as universal precautions. All the same thing, just different names. OSHA guidelines, gloves is one of the biggest ways to prevent that. However, if you touch something infected with your glove and touch your face, you're still going to get sick. Goggles, masks. Masks are huge. Believe it or not, one of the biggest things with masks is it isn't stopping airborne transmission. It's stopping you from touching your face. That's how a mask works. You're not touching your nose or your mouth with an infected finger. Gowns are good, respirators are good, but the number one way to stop from getting sick is wash your freaking hands after every patient contact immediately. As soon as your gloves come off, wash your hands. Or have one of the biggest things, at least in pretty much all of our UC now it's driving me crazy. Now I gotta scratch my nose because it's psychological if you think about it. But I keep a hand sanitizer in it. It's the gel, whatever it's called, Purell, same stuff that's in the dispensers all over here. But even if I'm wearing gloves, I'll still put Purell in the gloves just to kill it. The more you wash your hands, the less sick you're going to be. Any questions? Immunizations. So how do the immunizations work? A lot of people don't understand this. So your immune system is fighting off bacteria and viruses literally 24 hours a day. The world we live in is filthy. It is a filthy, dirty world. And there's bacteria and viruses everywhere. Your immune system kills 99.99% of them. It's constantly working. But every once in a while, something will get in there or your immune system will already be taxed. And something will get in there, your immune system doesn't know how to fight, and it'll actually make you sick until your immune system figures out how to kill it. And then it kills it. What immunization does is they take something that's known to be immune system tolerant, like the flu or polio or measles, whooping cough, something like that. And they take the dead virus and they inject the dead virus into you so your immune system knows what it is and knows how to kill it. So then when you're exposed to the live virus, it kills it for you. One of the biggest ones for EMS that you have to get is hepatitis A and hepatitis B, because that will kill you. You got 1,000 times better chance of dying from hepatitis than you do from AIDS. Any questions? How immune systems and vaccinations work? I strongly recommend you get your vaccinations. So every agency you work for, whether it be volunteer or paid, is going to have an exposure management plan that's required. And what that plan is if something goes wrong, if you're doing everything right, it should never need to be put in place. But if something goes wrong, and if there's humans involved, something will probably go wrong. It's a plan on what to do if you are exposed to bacteria or viruses in the field. It is your responsibility to be educated on what your agency's exposure management plan is, so you immediately know what to do if something goes wrong. Any questions? Like you take your glove off and then patient bleeds on you and you have an open cut, or you stick yourself with a dirty needle somehow. Any questions? All right, stress management. This is a high stress job. So you got to recognize the signs and symptoms of stress and understand what it does to your body. And it's based on fight or flight. So what is fight or flight? So this goes back to caveman times. A caveman's got his club, he's walking through the jungle looking for a girl. Saber-toothed tiger jumps out at him. What does he got to do? He's got two choices. He can fight the tiger or he can run for his life. Doesn't matter what he chooses because he's going to need the same tools. He's going to need his eyes dilated. He's going to need his bronchuses dilated so he can get the most oxygen in, the most carbon dioxide out. He's going to need his blood pressure raised and his heart rate to go faster. He's going to need all the blood shut off to his stomach and his glucose stores going to dump to go into the cells to get the maximum amount of muscle energy to fight or run for his life. That's what fight or flight is. Well, stress is when you're in fight or flight and you never come out of it because you're constantly in fight or flight. That's what stress is. And the way you beat that is by critical incident stress debriefing or stress management, which we're going to teach you right now. So here's an example of signs of stress.
At the river mouth, the bears catch only the tastiest, most tender salmon, which is exactly what we and John West want. Show message you're the worst to bring you the best.
Any questions? That wasn't real. So what causes stress? Dangerous situation. Overwhelming physical and emotional demands, critical patients, dead and dying patients. Overwhelming sights and smells. Believe me, you're gonna smell some stuff. Multiple casualty incidences where a lot of people are hurt. Angry people. There are angry people everywhere. Online, in real life, they're everywhere. Unpredictable demands, that's what I actually like about EMS is, because you never know what's gonna happen next. And of course, non-critical 911 system, 911 patients tying up the system. So what are the signs and symptoms you're under stress? Your heart rate and your respirations are up, your blood pressure's up. You get pasty skin, your pupils are all dilated, you're tensed up, especially in your back and your neck. Your blood glucose goes through the roof, and you're not very hungry because there's no blood flow going to your stomach. So it's okay if you get stressed and then you have what's called the recovery period and everything's good. But if you never get that recovery period and you're constantly stressed, it's going to lead to massive health problems, weight, overweight, diabetes, alcoholism, drug abuse, all kinds of stuff. How do you see signs of workplace stress? There'll be indications. Like this. This is not an example of how to manage workplace stress. Any questions? All right, getting along in a team environment. You're not going to like and get along with everyone on your team. At some point, you're going to get a team there's people you don't like. That's okay. People are going to come from different cultures, different backgrounds, and different experiences. Not everyone's going to get along. However, again, the patient has to come first, not you. Workplace kidding and teasing has a great spot to break the tension, but it can also lead to discontent. So you got to walk a real fine line with that. Know the boundaries. And the biggest thing of all is no matter how much you dislike people, you still have to be supportive of your teams to make sure that you all work as the best possible team for your patient. Any questions? All right, so general adaptation syndrome. This is about stress management. The alarm state, that's when the saber-toothed tiger jumps out. Reaction to resistance, that's when you fight for your life or run for your life. And then when it's all over, that's when you recover. Go back to your cave, lay down on your nice rock couch, relax, turn on the TV, recover. Any questions? No questions. So, sometimes people in emergency services will have what's called a delayed stress reaction. Because again, we're going to teach you and we're going to practice this again and again and again till we get to the point where you can't possibly do this wrong. Okay? So sometimes in real serious critical situations, you're not even going to think about it because you're just going to do as you were trained and as you practice. So that's another part of this too, is if you screw around and practice in skills and then something bad happens, you're going to go into autopilot mode. You're not going to do well. If you pay attention and you practice hard and you study hard, when that goes in and you go into automatic mode, you're going to do real well. The delayed stress reaction comes after the incident's over. Then you go, oh my God, what just happened? That's a delayed stress reaction. Now, cumulative stress reaction, there will be test questions on this, is when it's not the one big incident, it's not the garbage truck running over a child that you responded to, or a plane crash or something. It's constant small stressors all day long that puts you into that fight or flight mode that you never get to come into the recovery mode. That's called the cumulative stress reaction. And either one of these, if not properly dealt with, will lead to post-traumatic stress disorder, which is why, if untreated, The average career in emergency medical services is about 4 years. Because people just burn out with post-traumatic stress disorder. Any questions? There's right ways and wrong ways to handle workplace stress. This is not the right way. Might have seemed like a good idea at first. So how do you deal with it? First thing is always remain professional. Eat a good diet, regular exercise, find time to relax. That's the hardest part. So you get in that recovery state. You have to get good sleep. You have to balance work, family, and health, which is very difficult with the schedules, the hours, but you have to do it. Drive-through diets are a bad idea. Been there, trust me, I know. Any questions? Yeah, there are good ways to deal with it. Debatable.
The monkey parts and human parts are basically the same. They both have the same vessel supplying the brain, school of humor. It's gonna be different practicing on a dead human though versus a live monkey, but practice is practice. So today I'm gonna be practicing isolating chronic and vertebral arteries, both sides. We need to isolate them, the ones that supply the neck and the face, and so like tie them in, both superficial and deep ones, like tie them in. Not trust me work, it can be a little ugly, especially if the skin starts to slop off. Oh, Jesus! There you go. Go that way.
Exercise is always important. In a gym membership, or you can work out at home like this. So what kind of workplace issues cause stress? Cultural diversity, lack of teamwork, sexual harassment, and substance abuse.
Johnny's lesson, being proactive over reactive. Johnny was a young, dedicated emergency medical technician, EMT, who took pride in his work. One evening, he was dispatched to perform a basic life support transfer for a patient using a morphine PCA, patient-controlled analgesia. Johnny knew the PCA was securely locked and pre-programmed so the patient could self-administer up to 2 milligrams of morphine per hour. This task was well within his scope of practice, and he completed the transfer confidently and professionally. Later that evening, Johnny was assigned to an advanced life support, ALS ambulance, with Robert, a paramedic, and the shift supervisor. After responding to their first call, a suspected cardiac case that turned out to be indigestion, Johnny began restocking and cleaning the ambulance with his usual diligence. As he worked, he overheard a troubling conversation between Robert and an ER nurse named Susan. Susan expressed her belief that it was inappropriate for an EMT to transport a patient with a morphine PCA and claimed it was outside an EMT's scope of practice. Robert, eager to maintain his image rather than clarify the facts, agreed with her and even gave her the contact information to report Johnny to the regional EMS authority. Johnny listened quietly, his heart sinking as he realized that his competence was being unfairly questioned. He recognized that their lack of understanding and willingness to escalate the matter stemmed from ignorance rather than malice. Faced with this situation, Johnny considered his options. Confrontation. Johnny could confront Robert and Susan, call out their ignorance, and demand they understand the EMS system better before accusing him. Revenge. Johnny could stay silent for now, but find a way to retaliate against them personally later. Proactivity. Johnny could let them proceed with the report, knowing the EMS authority would investigate, confirm he was within his scope of practice, and educate Robert and Susan accordingly. Johnny remembered the wisdom of a seasoned paramedic during his training. You can't control what others say or do, but you can control how you respond. Always strive to be better than those who tear others down. Work hard, stay impeccable in your actions and words, and let the world see who the better person is. With these words in mind, Johnny chose option 3. He let the process unfold, confident in his knowledge and professionalism. Sure enough, after Susan reported him to the EMS authority, the investigation revealed that Johnny was entirely within his scope of practice. The authority contacted Susan's hospital administration and Johnny's ambulance service to address the misunderstanding. Both institutions implemented remedial education sessions for Susan and Robert, ensuring they learned the basics of EMT scope of practice. The situation was highly embarrassing for both Robert and Susan, while Johnny's professionalism and integrity remained intact. Johnny continued to excel in his career, striving every day to improve himself and serve his patients with dedication. He never allowed the negativity or ignorance of others to derail his progress. Moral of the story: always strive to be the best version of yourself. Acknowledge your mistakes, learn from them, and work to improve. When others falsely accuse you or spread misinformation, choose to be proactive instead of reactive. Your dignity, professionalism, and commitment to growth will set you apart, while those who act out of ignorance or malice will face their own patterns of failure.
Any questions? That's how to handle workplace issues. Come on. All right, death and dying. You generally go through 5 stages. First stage is denial. You don't believe it's happening. Then anger. You get upset about it. Then you try to bargain. And then you come to terms with it, and it's really, really depressing. And then the final stage is acceptance. So the best way to explain this isn't from me, but from a giraffe.
Uh-oh. It's no big deal. It's probably not even quicksand. I'll have a good laugh about this tonight with the guys. Well, this is just perfect. Stupid quicksand, stupid jungle. I want to bite someone in the face. Mother. Ow! That stupid jungle. Are you there, God? It's me, Giraffe. Listen, if you would just give me a mulligan on this quicksand thing, I promise. No more in on your shorter creatures. But you get a deal? You know something? I'm cool with this. I bet heaven has all the tender leaves I can eat, and everyone gets their own slurping machine. Yeah, take me, sweet death. I await your loving embrace. What? I think I hit the bottom.
Any questions? We're gonna skip this one because we're out of time. All right, so critically ill patients, don't say sad and grim comments. Orient the patient and family to what's going on and always be honest. Worst thing you can say is it's gonna be okay, because it's most likely not. But always allow for hope. Any questions? Seed hazards, things that can cause problems, hazardous materials, electricity, fire's really bad. Traffic collision is the #1 way that people in emergency services get killed. Weather, especially in areas like this. Violent situations and behavioral emergencies, also very major hazards. This is not an uncommon scene. Any questions? Domestic violence also can be scene hazard. Any questions? Huh, we actually knocked it out faster than I thought we would. All right, so here's some examples of what you're gonna face on the tests. So the blank deals with the well-being of the EMT career projection and EMT compensation. Would that be the medical director? Would it be the local public health department? Would it be the human resources? Nobody?
Yeah.
EMS administrator or chief? What's the best answer? All right, so you guys are good. All right, which type of stress reaction occurs when the EMT is exposed to many insignificant stressors, but over a period of several months or years? Is that a cumulative stress reaction? Is it a critical incident stress reaction? Is it an acute stress reaction? Or is it a post-traumatic stress reaction? Which is the best answer? Hey. No, that's not right. What the hell? It's A. All right.
Are you sure?
I am sure. So critical incident stress management can occur at an ongoing scene in all of the following circumstances. So critical incident stress management is when they actually feel debriefing at a large, long-term scene, like a mass casualty incident. So it can happen on all the following except, and except is in big bold print. So before leaving the scene, after the incident is resolved. No, it wouldn't be it, because they do it, that's when they would do it. When patients are actively being assessed or treated, that's when you wouldn't do it. When personnel are assessed during the periods of rest, that would be when you would do it. And before personnel are preparing to re-enter the scene. So which one of those is the best answer for accept? B. Review your study guide. So I want to go over with you guys real quick Canvas. Just so we all know what we're doing here. Come on. So on your Canvas, some important things to know. So a lot of the stuff is going to be under syllabus. Got your first day handout, any of your skills forms if you want them to print out. That video on how to do the packet for your instructional video. The actual form you click on right here, you can get it on your phone. A link to all the lectures and PowerPoints and class videos from previous lectures. And there's also a patient assessment simulator, which you probably shouldn't do now, but when we start doing patient assessments, it's a great way to practice your patient assessments. More videos, your skills sign off practice packet if you need it. And then all the presentations, if you want to review these, are right here. Everything that we just went over, you can click on it, you can re-look at them. And then it's also got your schedule. See, like tonight, practice quiz chapters due 1 and 2, tomorrow 3 and 4, but I'm not going to hold anybody to it until Thursday. But then 1, 2, 3, 4, and 5 need to be done with at least a 9 out of 10 score. Again, you can take your practice quizzes as many times as you want. Now your quizzes, if you come over here to quizzes, click on that. These are the actual exams when we're taking them. But your practice quizzes are right here. So you need to do these 5 by Thursday, have at least a 9 out of 10 on each one of them. Take them as many times as you want. Even if you get a 10 out of 10, keep taking it. You're going to keep seeing more questions. You're going to keep getting better at it. The rest of this Canvas, things that lead people astray, the test prep and a lot of this other stuff, just don't even pay attention to that. The biggest things are your syllabus and your quizzes. Any questions? Yes, sir.
There'll be a lot of modules we're gonna have to focus on.
No, there's no, what do you mean by modules? Like right here?
Yeah.
Yeah, no, ignore those. Okay. Don't even go to them. Just worry about your practice quizzes and the links on your syllabus. Those are your two things. Any questions? All right, go to break. Be back at 8 o'clock, ready to do skills. And we're gonna teach you our first skills.